Floor lifts are used when a patient has fallen. Falls sometimes occur in places difficult to access with a lifter. A patient can be moved to a more accessible position using good manual handling and slide sheets. Rolling a patient onto a sling for a floor lift is the same technique as used on the bed. Use of a pillow under the patient's head will greatly improve their comfort. There are 3 ways of approaching a patient for a floor lift. The approach used may depend on the patient's position. The approach from the side is good in most cases. Once the patient is on the sling, open the lifter legs and raise the patient's knees. The lifter is moved to the patient with one lifter leg passing under the knees and the other one passing alongside the body towards the patient's head. Once the lifter base is close to the patient, lower the arm and align the cradle frame to attach the sling. The patient's feet should be supported on the first part of the lift to avoid contact with the lifter base. The patient can be approached from the feet by lifting them over the base. Once again, the feet should be supported for the first part of the lift. Finally, the patient can be approached from the head end. The pillow is very useful with this lift. The rear caster brakes are applied by pushing the large lever down and released by pushing on the small lever. Using the lower body weight through the feet is important when moving the lifter, particularly with heavy patients on soft floors. A foot should be used to align the casters in the direction of travel, to start the lifter moving and to change direction. To rotate the patient past the mast, the arm may need to be lowered so that the feet pass under the motor. For transport, the patient can face the rear with both feet on one side of the mast or can face the front. The arm should be low.